Well, COVID cases rising in the past couple months. We've got a summer surge, right? Some Bay Area counties are recommending the community to take precautions as the CDC warns of a potential vaccine shortage. Joining us right now to talk about the whole summer surge, the vaccines, fall vaccines, all that stuff, Arnab Mukherjea is the associate professor at Cal
State East Bay.
Cal State East Bay. I always want to revert back to the old name,
yeah.
Which is stuck in my headspace. Tell us a little bit about what you guys are seeing out there. We know that wastewater is showing that we have had a summer surge. So how can we best take care of ourselves? Contra Costa County recently said, the public health said, wear a mask if you're inside with a lot of people. So what are you guys saying?
So you're right that what you're reporting is consistent with what's in the literature, which is that we are seeing a summer surge.
Yeah.
This is the highest surge we've seen in the summer months since the beginning of the pandemic. It's not as great as the winter peaks that we've seen, so that's good news. Secondly, although rates are high, and these are largely based on wastewater data analysis, the rates of severe pulmonary disease related to COVID, hospitalizations and death, actually are very low. So although we're seeing greater infection rates, the severity of the infections seem to not be translating into greater disease and death, thankfully.
And Professor Mukherjea, how should we best equip ourselves? We're dealing with kids and loved ones and parents and grandparents, getting sick. So what do we do about that?
So I think we practice those basic principles that we learned in grade school and that we've reinforced during the pandemic months. So first and foremost, good hygiene, washing our hands, all those things that we know but sometimes tend to put on the wayside. Secondly, I think it's important to be attuned to our own health, not just for our own ability to get sick and whatnot, but who we might infect along the way. So as you said, Contra Costa County has put in guidance for a mask, not a mandate, but just guidance to say that when we're in crowded indoor spaces or areas where there's a lot of intermingling with other people, that we should exercise precaution. And that's just basically wearing a mask, especially if you're feeling ill or sick. Again, I want to reiterate that the severity of the disease and any more adverse consequences are not very high at this point, so I don't think people need to be cause for alarm, but I think we need to basically exact the principles that we learned early on in the pandemic.
And we also learned that during the pandemic, to wear a mask would be, one of those surgical masks or and then that there's no shame, that we're just kind of trying to take care of ourselves.
Right, absolutely correct. And I think those of us that have people who are elderly in our family, myself included, those of us that have folks in our family that are, or in our peer circle that are immunocompromised, I think it's just a matter of respect for them, just to make sure that we're doing what we can to keep you healthy. So I don't think there's any shame, and I think the last 3 years have taught us that really wearing a mask is not just protecting ourselves, but also sort of affection for a fellow human being.
Let's talk about vaccines in the fall.
Sure.
I know that I went online and, there really isn't much out there right now.
Right.
So we're all waiting and kind of focused on the flu vaccine as well as the latest COVID vaccine. So what should we know about that coming down the pipe?
So the earlier vaccines that we have currently were created for variants that are no longer highly in circulation.
Right.
And so what we're waiting for right now, there's a family of variants called the flirt variants. KP.311 is sort of the most common one. Again, it's more highly contagious, which is probably what's responsible for the summer surge. But again, I want to reiterate that the severe disease and death are still at all-time lows. So this new vaccine that's scheduled to come out in September or October of this year really is tailored towards those variants. So going out, rushing to get a vaccine right now, first of all, it takes about 1 to 3 months to kick in, and second of all, it's tailored for a variant that's no longer out there anymore. So I would say, do everything that we've talked about. Hygiene, wearing a mask in those areas that are more sensitive, but at the same time, making sure that we get our vaccines as soon as they're available in September or October, because those are the things that will protect us for the next summer surge that will happen next summer.
So a lot of parents and guardians have kids going back to college, they're going into these mass areas. So what would you say to, kids going back into school?
Well, luckily, most college-age students, mine included, not my own kids, but my students, they're usually more so than not healthy and are able to, not deal with severe consequences.
Right.
That being said, I think the thing we need to be more attuned to is, 5, 10 years ago, if we had a sore throat, if you're runny nose, you know what? You just go to class, you just go do what you're doing. Now, I think it's important to, take pause, not take yourself out of, circulation or isolation or anything like that. But take pause, take a look at your symptoms, make sure that you do the things that we talked about. Test yourself. If you do test positive, you know, the guidelines have changed a little bit. It used to be that you would isolate for 5 days and then go back out. Now the guidance is for 24 hours, you monitor your symptoms. If you're fever-free.
So 24 hours.
24 hours, if you're fever-free and your symptoms are improving, you can go back to your normal duties. Again, the guidance is that you wear a mask just to protect other folks, because even though if you're feeling fine, you still may be shedding virus, and that might affect other people.
You don't want to spread it to you and to others like that.
Exactly, especially not your professors.
Correct. Thank you very much, Professor Mukherjea. We really appreciate you coming in and spending the time and giving us this information.
Thank you for having me, Teresa.
Okay, we'll be right back.